Explain to me, what is dental hygiene?
Dental hygiene is all preventative care.
Yeah, and you were saying that there's like 19 different diseases
And
or
counting.
that people can encounter if they don't have the proper hygiene.
There's like a strong correlation with several, like hypertension, heart disease, and like diabetes are the most well researched, but there's more and more research coming out about Alzheimer's, and there's a correlation with oral health. If they lose the tooth and nothing is done, spacing becomes a concern as their adult teeth grow in.
Namrita and Stephanie, such a pleasure to have you both on the Best of White Rock. I was really looking forward to having you on here because we had such a fun pre-interview call for this show, and you're doing so many neat things with your business and what you've really built over the last year or so. You're a year freshly into this new adventure for you both, and both been doing it for quite some time, but new adventure for you in opening Haven Dental Hygiene, right? Did I say it right?
Yeah.
Yeah. Okay. Well, I'd love to hear a little bit about Haven Dental Hygiene. Tell me a little bit about it.
Well, it is the first independent dental hygiene studio in White Rock.
It's the only one in White Rock.
It's the only one.
Wow.
Yeah. So we're the first. Yay. And we had a vision to bring preventative dental hygiene services to people who need it, which is everybody, but also to kind of encompass wellness. So to have other complementary services and practitioners in the office space as well. It took us a really long time to find the space. We were pretty strict on parameters and how far we wanted to go. And we live and love White Rock, so we wanted to stick in White Rock. But the space was larger than we maybe truly needed, but then we did have the vision of including other practitioners as well.
Yeah, and I want to touch on that a little bit later on. I think that's neat. So you're in the Altus building, is that right?
Yeah.
Mm-hmm. Yeah.
Across from Peace Arch Hospital.
Yeah, and what a fun building to be in. I mean, that's kind of like the big new building in White Rock, and the ads alone on the radio and TV were all over the place. I guess it's been around a little bit longer now. But so for the average person watching, I am guilty of this, and I admitted to this prior to sitting down. Explain to me, what is dental hygiene beyond what the words actually mean?
Dental hygiene is all preventative care. So it's scaling, polishing, fluoride, sealants. It's whatever services you would have at a traditional dental office before the dentist comes in and does an exam. So we can take x-rays, we can diagnose bone loss, periodontal disease. If we see something suspicious, we would want to share that information with your dentist. So dentists are more restorative, and then hygienists do the preventative care.
Oh, interesting. Okay, so like if I was regularly going to the dentist sort of thing, would this be something you would incorporate in between those visits typically? Yeah?
Yeah.
Okay.
Most patients need an exam once a year. A lot of patients need hygiene every 3 to 4 months for various reasons, whether they build up a lot of calculus, a lot of build up on their teeth, or they have systemic conditions, which would warrant more preventative care.
Okay, that's interesting. And so what, like, how did you even get into this? Where did this start? So your business is a year old, but you've both been doing it for quite some time.
Yeah. Almost 20 years.
Oh, cool. Okay,
yeah.
Long time.
Yeah. I knew I always wanted to do something in healthcare. I wasn't sure in what capacity. And I loved my dental visits as a child.
You loved your dental visits?
I did.
Okay.
I couldn't understand why patients had dental anxiety.
Yeah.
So something in healthcare, and this really kind of spoke to me. You get to really talk to a lot of different people from all walks of life, all ages. It's fun. Every day is different.
Okay. And what about yourself?
It's pretty much the same. We say we're like Siamese twins that were separated at birth because we're so similar. But yeah, I knew I wanted to do healthcare. I knew I didn't want to do nursing necessarily, but something along those lines. Same thing. My mom has severe dental anxiety, but she always made dental visits like really great and fun for my brother and I growing up. And so I had really good positive experiences. And I thought, well, I could do this. This sounds like a good fit. And I feel the same. I love hearing everyone's stories. Like every hour or so, you get to meet a new person and hear what's going on in their lives. And yeah, and just nice to connect with people in that way.
Well, I know when we first were introduced to each other, I just got the vibe that you have a lot of fun at your office. Like I got the tour on the Zoom call sort of thing, and it was a really big office too. But everybody seemed so lovely, and everyone had huge smiles on their faces, and it just seemed really fun. So I would encourage everybody to visit nonetheless. Why was the office so big?
Well, we kind of touched on it earlier, just the fact that like we looked for so long for a commercial space and it took a really long time, and yeah, we were picky about the location, not being too far from our kids' school and our homes. And this was one of the, I think we looked at 3 in the Altus building,
Within
right?
the Altus, yeah.
Yeah, and this was kind of the best fit for a few different reasons. And yeah, and then we wanted to incorporate, like we have our teeth whitening lounge where people can do teeth whitening but enjoy a massage in our massage chairs while they do the teeth whitening. So we wanted to dedicate a space to that. And then we wanted to have some enclosed rooms in case some of our patients have more dental anxiety and they want to do the appointment in an enclosed space. So this larger space allowed for that, as well as the other practitioners that come in.
Yeah. So who's your ideal client then? So, somebody watching this and they're saying, oh, you seem very lovely. I'd like to go visit the Altus building. Sounds like you've built a really cool environment for people to come. Who should we be, talking to? Who would your ideal client be?
Honestly, anybody and everybody. We have a lot of seniors who come in. We have 1-year-olds. There's a daycare down the hall, and so the kids walking by will kind of poke their head into the office, and parents have brought them in, and it's been such a positive experience for them. With the seniors, we do accept the Canadian Dental Care Plan, which drew some patients in, and they were like, this feels so different. I don't hear a drill in the next chair. I don't feel like I'm being rushed through. We really tailor our appointments time-wise. We can add extra time. We have the flexibility to be able to do that. And I think that helps with seniors.
Yeah, I would imagine it would. And actually that you brought up the Canadian Dental Care Plan, is that what it was called? Yeah, I mean, that must have been a nice change for, I'm assuming anybody in the healthcare industry related to dental and whatnot, because there's probably a lot of people that need that help and just simply aren't doing it because they, I guess, maybe can't afford it or maybe even aren't aware that they need it, right?
Definitely. Yeah, people kind of put it on the back burner for several years, and then finally they have some coverage. So it's not ideal, it's not the best, but it's definitely better than nothing.
Yeah.
So it increases that access to care, the preventative services. So we've met some patients, they said, oh, the last appointment I probably had was 5+ years ago. And so we'll do what we can, and again, it's better than nothing. But
yeah, and you were saying that there's like 19 different diseases
and counting
that people can encounter if they don't have the proper hygiene.
There's like a strong correlation with several, like hypertension, heart disease, and like diabetes are the most well researched, but there's more and more research coming out about Alzheimer's, and there's a correlation with oral health, COPD, which is like a lung disease. So there's quite a few. And so the less inflammation in our bodies, the better. So if we can kind of manage and control inflammation in our mouths, then it kind of trickle down effect to the rest of our body.
Have you seen some pretty wild examples of people that you probably wish they had come and seen you years in advance, but I mean, especially with people having access to this care now, have you seen some pretty wild examples of people that just left it far too long?
For sure. Yeah.
And just out of complete curiosity, are these people in the are they on the path to losing teeth at that point?
Yeah.
Usually, yeah.
And I'm assuming dentures are a lot more expensive than visiting on a relatively frequent basis.
Yeah. Yes, and they're also not a great solution. They usually don't fit that well, or if they are to fit better, there's implant surgeries to make them click on a little bit better, which is a huge cost.
Right.
So
it's often invasive. It requires
yeah.
surgically implanting.
Is more of your stuff that you do, is it more preventative, would you say, or is it more cosmetic? Because you do both. Do more people come in for the preventative side?
For now, sometimes the draw is whitening. People will find us on Google because they Google teeth whitening, and then we recommend a hygiene before a whitening for best results.
Okay.
And then they're like, oh, you can do that here. They're like, oh, I thought I would have to go to my dental office. So it brings patients in, but then it kind of complements the hygiene and the whitening together.
You must be very busy at like grad season and whatever,
Weddings.
Weddings, yeah,
Yeah.
another big one.
I think Father's Day maybe. We've
Yeah.
had a lot of men in lately
Really?
for teeth whitening, and I don't know if it's timing with that, but
It's usually their spouses who book them, though.
yeah.
Yeah.
Yes, we've had that too.
I would have thought it would have been
Yeah.
like pre-Mother's Day, because we, like, for our real estate business, we had a bunch of the mothers come out and they brought their families. We did like professional photos for them. So I'm just imagining getting
yes.
dragged to like go get my teeth whitened. Like, you're not
Prior
showing up
to.
like that and that sort of thing. And
Yes.
yeah. So
It's good timing.
you've been doing this a long time. I'm always curious, and this is always a really fun story. Like, have you had an experience where somebody came in and they had a big problem happening? They had something going on, and you maybe felt like the last resort, like they didn't know where to go, they didn't know what to do, they didn't know how to solve their problem. Do you have any stories like that of where you were able to really help them and kind of save the day, and they came out in a better spot from when they first arrived?
I can't think of any like one big sort of kind of miracle story, but we do like the overcoming the dental anxiety is really huge. So many of our reviews and so many of our patients have said to us, like, I hate coming to the dentist, and this was such an amazing experience. I felt relaxed and comfortable. We do a lot of extras like a weighted blanket, under eye patches, noise canceling headphones so you can watch Netflix or Prime Video, and aromatherapy. And then again, like Namrita said, the flexibility of time, so we don't have to rush through anything. Some patients that have anxiety, they want to get it over with, and then we can try to streamline that way too. So I think that's a pretty big win, to sort of get patients past that fear, and then they can get back into a regular kind of program and interval. But also, like, we've had a lot of the little kids from the daycare, or our friends' little ones, we have made their first visit like really positive, and that's a huge win for setting them up for a lifetime of positive experiences surrounding dental.
Yeah, well, I'm curious about dental anxiety. So does that maybe stem from childhood, like people just generally being scared of the dentist, or like have these poor people been poked and prodded so much that they're just completely terrified?
Maybe, pretty much one bad experience can kind of set them up for failure.
We've had a lot of patients say, oh, my dentist didn't fully freeze me, so I could feel what was happening.
Oh my gosh.
Yeah, it's mostly a little bit of the older generation where they've said, like, the drill was really loud and there was no TV, so I was focusing on what was happening in my mouth.
Yeah, well, certainly, I guess, like when they get to the point where they, it's maybe past the hygiene point, it's really like, or not preventative, it's like this
Now it's restorative.
Now it's restorative, yeah. And I mean, nobody would enjoy that. I mean, even the idea, you said the word drill, and I started shuddering, thinking I've been blessed to never have a cavity, but I'm sure it's not a pleasant experience. Yeah. Now, you mentioned Google reviews a little bit. It's always a fun question, and I'm curious what, and you kind of touched on it a little bit, but if you had to summarize all the Google reviews or just the general feedback that people give when they come and visit your business, well, what do people say?
The word calm comes up a lot.
Calm.
It was a calming experience.
Okay.
Yeah.
Yeah, we get all 5-star reviews, so
Amazing.
Hopefully that
continues.
Yeah, and that kind of gives an umbrella, of the experience for everybody.
What makes it calm?
Like Steph touched on, we do the weighted blankets, noise canceling headphones. We really try and chat with patients beforehand, try and build a relationship, a rapport. Both of us have kids in sports, so if a client has kids, we often have a connection through one thing or the other, whether it's hockey or soccer. And then a lot of our clients live in the area, so there's often a familiar food spot or the beach, something that we can connect with. And so once they just get chatting, you can almost see the tension leave their bodies.
That's awesome.
Yeah.
Well, and if you've got kids and you're in like the Ravens hockey or the coastal soccer, everybody in White Rock
Pretty much,
Or at that age, right?
Yeah, 100%. Yeah, it's amazing. You start to see all the same people, and you're kind of with them every single year almost, right?
Yeah.
You're seeing them at the fields or the ice rinks and that sort of thing. And
Yeah.
you're probably thinking too, thank goodness hockey's over now, and I'm feeling the same way. So it's exciting
Yeah.
to have a little bit of summer back and whatnot.
Totally.
What's your favorite part about what you do?
Building the connections, I think.
Okay.
Yeah.
Yeah.
Having the independence to do things how we want to do them.
Right.
Taking the time to do the blood pressure screenings on every patient. We've had so many patients say that, oh, I've never had this done before. And then we'll complete the reading and they're like, oh, I didn't even know that's what my blood pressure number was. So just bringing awareness to what our scope of practice is. You know, we've taken courses in psychology and pharmacology, so we want to be able to showcase all of our knowledge and help it for everyone's wellness journey.
Okay. So with that journey, when people come visit you, maybe they're not completely aware of exactly what they're going to get when they visit and whatnot. If you could grab people by the shoulders and say, this is the number one reason that you should come visit us and come check us out or come, experience the services that we provide, what would that be?
Well, number one would be just to the immediate is just to kind of get freshen up. If you have any tartar buildup, aesthetically, even if you can see it, it looks whiter and brighter. So that's the first sort of thing because it's such an immediate result. But long term, having that systemic disease kind of oral health connection nipped in the bud sort of, and you're just on this trajectory of coming in regularly and preventing. After you brush your teeth, the very first layer of plaque comes back within 60 seconds. So it just builds layer upon layer throughout the day. So there's no way around it everyone needs scaling. It's just the way it is. So
what would you so you're both mothers, what would you say to people with young children, and maybe the misconceptions that they have about their child's health care with their teeth?
Well, there's such a laundry list. Fishy crackers are one of the worst snacks because they get really stuck into the kids' molars, the grooves of their molars. That's always surprising for people to hear. Right. There's so many things we've
heard a lot of, they're just baby teeth, they're going to fall out anyway. But if a child has decay on baby teeth, it's going to cause pain. They may have to get a stainless steel crown, which, is aesthetically, you can see it. And if they lose the tooth and nothing is done, spacing becomes a concern as their adult teeth grow in.
So getting them ready for braces and whatnot.
Yeah, but even if they lose the tooth and the adult tooth has almost too much space, it could shift over rather than coming directly down.
Okay.
So baby teeth are important. That's what we would tell parents.
Do you find a lot of people are kind of unaware or underappreciative of how to take care of their kids' teeth?
I think things have changed in the last decade for sure, as far as I've noticed. I did see a lot of baby bottle decay is what it was called.
Okay.
I think there's been a lot of education, but as Steph said, there's a lot of snacking now. A lot of snacking on complex carbohydrates, even juice boxes. People think that, it's just juice. Well, it's a lot of sugar. Even if it's natural sugar, it's still going to sit on your teeth.
Yeah. It's kind of same as a can of pop, right?
Yeah. Gatorade, the sports drinks.
Yeah.
Even the bubbly waters, there's no sugar, but they're acidic. So for the enamel, even for adults, it's not great to have them. I'm sorry. I know everyone's addicted to it. I know. I feel like the bearer of bad news. We had a patient though, and she was literally addicted to it. She said she drinks 5 a day, but she came in, her main concern was her teeth had all of a sudden become really sensitive. And so we were interviewing her, well, why? What's changed? What's in your diet? And she said, and I said, what else are you drinking? And she said, oh, yeah, I have bubbly water. And I said, how many do you have in a week? And she said, I've had probably 5 or 6 a day. And I said, well, there you go.
Wow.
That literally was what it was.
And 5 to 6 a day, that's almost like getting habit, smoking. That's starting to get expensive after that. That's
totally.
That's a lot.
Yeah.
So what can people do, when they come visit you and you're they are doing it all right. They come in and it's still good for them to come in and have those checkups and get that regular maintenance and whatnot. But what would be some really good habits that you would suggest that people carry on day to day?
Electric toothbrushes are great. If you're not using one, the majority of the population would benefit from using one. Flossing, obviously, or something instead of floss. some patients, say, I don't want the lecture. I've heard I need to floss. You don't have to floss, but you have to find something to clean in between your teeth.
Right.
Yeah.
It's like a water pick.
Yeah.
It's not a replacement for flossing, but it's a great adjunct if you're not going to floss at all.
Yeah. It seems like it's one of those things where like it's not a need for more information. It's a need to do what we know we're supposed to do with the information that we have.
Or tailor it, right? Like Namrita said, like the psychology background that we have is helpful on so many levels. And that's another one. Like you can kind of read the patient. Are they ready to kind of make a change, or do they want to, like, do you have to just tailor the suggestions to what they could potentially try and like and get in the habit of using?
If they're not going to do it, you can tell them to do it a million times, but if they're not going to do it, what path can you give them so they will at least improve their situation? Yeah, it's interesting. So I'm curious. Being in White Rock, fully immersed, you're in hockey, you're in soccer, like you know everybody already. Has being a part of the White Rock business community, has that changed the way that you operate or the way that you look at doing business in our community?
I think so, yeah.
In what way?
We feel truly supported. We've had a lot of staff from the hospital come through. We're working with Peace Arch Hospital Foundation right now. We're going to donate a portion of our proceeds for the year for all of 2025 back to the foundation.
Wow.
So that feels really good for us. And it's being reciprocated with the staff coming in, seeing the signage. Just other businesses within our building, they've almost all become patients and fans.
That's amazing.
We like to eat at one particular eatery very often, so their staff has become supporters.
They're very supportive. And word of mouth is still the best form of marketing, right? And it seems like when we've made all these connections, like they'll tell two friends and then they'll tell two friends and so on. So it feels really good to be supported by the White Rock community.
I love that, because that means, word of mouth, if you want people to talk about you, you need to give them something to talk about, right? And if people are talking about you, that means they're coming and they're getting an experience or results that they never had previously. And that's just such a great way to run a business. Like I'm in real estate, as I mentioned, and like, I could have bus benches all over the community, but if I don't need to do that because my own community is supporting me because of the way that we're able to take care of them, that means we're doing something right. Mm-hmm. And it's a heck of a lot more profitable. It's expensive to advertise in all the mediums. And, when you start getting into advertising, people don't really know the difference between maybe you and, although you're the only one at White Rock, but like, they don't necessarily know the difference between you and some of the other services out there. So I think that's really noble. I got a question for you. This is called the Best of White Rock. And I would love you to tell everybody that's watching this why they should come visit you.
We're super fun.
And I can vouch for that. I would agree with that. Yeah.
Like Steph touched on, we're trying to encompass wellness. We have a new term, Haven Life. We have other practitioners. We have nurse practitioners who are in, and they're doing Botox for cosmetic and therapeutic purposes. So a lot of times we will do the screening and patients will say, I clench or grind my teeth. I've tried everything, or I don't like wearing my night guard. So we can refer to the nurses for the Botox. We have physiotherapists that can work on your TMJ. We have a medical esthetician who does lymphatic drainage facials and buccal massage. And buccal massage is where you go internally and you literally massage your cheeks, and that helps ease facial tension. So a lot of head and neck wellness, and then that leads to overall wellness, because if you've got jaw tension, you likely have neck tension, you likely have headaches. So I would say that's a big part of it.
Okay. Is there anything that you would want somebody watching this to know?
One thing or several things. Basically everything we've kind of touched on, but if you want a better kind of dental experience, and you want to be pampered when you ask sort of who's the target audience, definitely everyone. We can see like 0 to 99 or 105 years old, but just because we're busy moms, we do, I think, get a lot of good positive feedback from other moms who need to multitask. Like, when do you have time to put a sheet mask on? Why don't you do it while we're cleaning your teeth?
Yeah.
Right?
That's great.
Yeah.
Okay. Well, how do people find you? Where do they go if they're interested in checking out Haven?
Google,
Yeah,
Instagram, our website.
Okay. What's your website?
havendentalhygiene.com.
Haven. And so we'll put that in the show notes too to make sure that everybody has access to that.
Perfect.
This was a true pleasure. I really enjoyed getting to meet both of you, and thank you for sharing your story. You know, you built a really cool business over the course of just 1 year, and I'm really excited to see where that goes over the course of some time. So I hope everybody has an opportunity to come check you out and your business continues to flourish. And
Thank you so
wishing you the
much.
best.
Thanks
Yeah.
for having us.
Yeah.
It was really fun.
Thanks so much.
Thank
I
you.
really appreciate
Yeah,
it.
thank you.
Thank you.
Good.
Thanks.